Hi again, everybody. Thank you for joining the Guide to Medicare brought to you by the Buffalo News and Univera Healthcare. Please welcome Linda Pellegrino. She's going to be our host tonight, and she'll be joined by industry experts to answer your questions about Medicare. So Linda, whenever you are ready, please take it away.
Well, thank you very much. And hello, everybody. And I'm glad that everybody is joining us for this. We'd like to welcome you again officially to the Guide to Medicare webinar presented by Univera Healthcare and the Buffalo News. And yep, I'm Linda Pellegrino, and I'm going to be your moderator this evening. So tonight, we're going to focus on the Medicare Advantage annual election period and better understand why it's important to review your Medicare coverage annually. So we're going to cover some of the basics as well. And we understand that this is a personal decision for everyone. You may be making it for yourself or a loved one. And you know what? There's a lot to understand. So for the next hour, we're going to hear from a team of experts. They're going to help us guide through what could seem first like an overwhelming amount of information, but we're going to break it down for you so you'll definitely understand. Now, let me introduce our team for tonight. We have Michelle Reichin. She is the Regional Medicare Consultant with Univera Healthcare. And Michelle, your job at Univera is to assist people with their Medicare choice to find what's best for them. So thank you for your expertise today, Michelle. We also have April Romanowski. Now, April is a Medicare Solutions Consultant with Lawley Insurance, an independent firm specializing in insurance benefits. April, you speak to clients on both individual and group levels regarding the intricacies of Medicare. So thank you for joining us. And we have Bill Daniels, Coordinator of Insurance, Outreach, and Counseling with the Erie County Office of the Aging. And Bill, you oversee Medicare counseling programs for the county, among other advocacy programs for seniors. And we are honored to have you today, plus Michelle and April joining us. So a few pieces of housekeeping before we get into the heart of our conversation tonight. We are recording this so you can refer to it as a reference, okay? It's going to be sent to you in a thank you email from the Buffalo News, and it will be posted on the Univera Healthcare site in the coming days. Your questions will add to tonight's conversation. Throughout the panel discussion, if you have a question, please drop it into the chat session. We have a Univera Pro, he's actually a rep, Ryan, who's going to be answering questions in the chat throughout the program tonight. So at the end of tonight's webinar, we will also provide contact information for each of our panelists. If you would like to reach out to someone with a specific question after the program, you'll be able to do that. Finally, at the end of the main discussion, we're going to give our panelists a chance to answer your questions live, those that may appeal to the whole audience. So some of you submitted questions before the webinar. We thank you for those. So we'll answer those at that time. We appreciate your experience and questions, so ask away. This is your hour. All right, everybody, what do you say we get to it? For our panelists, here's a question. Our first section will focus on how to know if you have the right plan for your needs. So Bill, let's go with you. Some clarity. Before we even get to that, let's really break it down. What is Medicare?
Medicare is a federally funded health insurance program for people that are age 65 and above, or people that are receiving Social Security disability. It has three parts to it. It's Part A, which is for hospital coverage, and it has Part B and Part D. So most people do not pay for Part A. When you start receiving the benefits, they pay for it or their spouse during their working years. If you've worked and paid into Social Security tax, Medicare tax for 40 quarters, there's no cost for Part A to you. Part B, you start paying when you receive it. Next year, it's $164.90 a month, unless you're higher income or if you're lower income. If you're lower income, set like under $1,549, the New York State will pay for Part B for you. It's available except people age 65 and above. It's also available to legally immigrants in this country However, most don't have the 40 quarters, so they end up paying up to $499 a month for Part A, as well as a Part B premium. Like it says, it covers hospital for Part A. B is for your doctors, supplemental services.
All right. Okay. Now let's run over to Michelle. Michelle, once enrolled, people have the option on how to get the coverage that Bill just talked about. So maybe you can tell us, what is the difference between original Medicare and the Medicare Advantage?
Is Michelle on?
Michelle, you're muted.
Okay, if we can't hear Michelle, we're going to ask her if she can unmute her mic.
I'm
And then-
unmuted.
There you go, Michelle. All right, let me go over the question again.
Okay.
We talked about, what Bill talked about is once you're enrolled, you have options. We talked about what exactly is Medicare. So once you're enrolled and you have options, how do you get that coverage? And then what is the difference between original Medicare and Medicare Advantage?
Yeah. So when we think of original Medicare, right, we always think of that Part A and that Part B. Everybody wants to know how to always apply for that Part A and Part B. And that's, of course, by calling Social Security to do all that. Its coverage is managed by the federal government, and it does not include prescription drug coverage. So basically what you do, you have to find a standalone Part D coverage in order for you to have that credible coverage for prescriptions. And the thing also, too, you got to remember with original Medicare is that it's a co-insurance. So when we think about original Medicare, we also always think about like an 80-20 split, where with that Medicare Advantage plan, it includes Part A and Part B, and it's umbrella of it all. It's also referred to as Part C. Again, it's the umbrella. It has the Part A that's included in it. It has Part D, and it has that Part D prescription coverage as well. And another thing, and a good takeaway, Linda, on this one is that when you have original Medicare, there is no out-of-pocket limit. So with a Medicare Advantage plan, there's a capped amount, and it's a copay structure.
All right. So April, then there are add-ons, because Medicare doesn't pay for everything, but the add-ons we can buy into. So what is a Medigap Medicare Supplement plan, and who would these plans work best for?
So a Medicare or Medicare Supplement, a Medigap or a Medicare Supplement plan is a plan that would be secondary to Medicare. So you have some options when it comes to Medicare. Michelle talked about Medicare Advantage. So your other option would be a Medigap plan. So these plans, again, Medicare is primary. So Medicare pays their 80% of your services, and the Medigap is going to come in and pick up that 20% balance. So you're not having to worry about those co-pays or co-insurances. Those would be taken care of. And there are a number of different Medigap plans that are available. But something that you do have to remember is if you choose to go with a Medicare supplement, there is no Part D coverage included like the Medicare Advantage. So you would need to find a Medicare Part D prescription drug plan to go along with it. And some other things to consider that are not covered under Medicare or the Medigap that are covered under the Medicare Advantage are those extra things like dental, vision, hearing, over the counter, the things we see advertised on TV today. So it's generally where I see people enrolling in this type of plan are high utilizers. Maybe you are getting some type of infusion treatment, or you really like the flexibility of going to see doctors in Florida and see doctors in Buffalo and see doctors in Arizona or wherever you are in the country, because this type of plan really has a national network.
Okay, and that kind of helps me with my next question to Michelle. I like my doctors. How do I know if my doctor is in my network? And how do I find an in-network doctor?
Of course. Well, with Univera Healthcare, 99% of our doctors are in our network, as well as 100% of our hospitals. So, usually when we do meet one-on-one with somebody, what we do is we encourage them to bring, a list of their medications as well as a list of their doctors. And then we, of course, will then, look into our providers directory and just give them a peace of mind that it is covered in our network.
Well, and I will also add, that's why I don't like calling one of those 800 numbers, because these people, whoever they are, they don't know my doctors, they don't know the hospitals. Well, here in Buffalo, you do, Michelle, if I talk to you, or Bill, if I talk to you. As a matter of fact, Bill, how do I know if my drugs are covered and what cost? Can everyone hear Bill? Because I can't hear him. Okay, Bill, we're going to work on your mic because we can't hear you. Maybe Michelle, we can go back to you. How do I know if my drugs are covered and what cost?
Yeah, of course. It's something that we have is called a formulary. So we're able to, again, encourage those people to bring a list of their prescriptions. And then, we look to see what tiers they fall on. We do have a 5-tier structure. And this is, something that, we always encourage people to do as our Tier 1s are our preferred generic drugs. And again, we have a 5-tier structure. So we definitely would be able to go over all of that with them.
Okay. Now, you know what, April, let's talk with you for a second, because let's just say we're turning 65. We have in the last 3 months, or we will coming up in the next 3 months. Where do we begin? How do I get started with Medicare, and how do I enroll?
Right. What a complicated question. So when you first become eligible for Medicare, the first thing to do is to actually apply for Medicare. And you really do that through Social Security. Social Security is the place you go to enroll in Parts A and B of Medicare. And once you have that in place, then you can add on a Medicare Advantage plan or a Medicare Supplement plan, a Part D plan, whatever it is you need to add to that Medicare. And we like, and I know Michelle and Bill would say the same thing, we like you to come in a little bit earlier than you turn 65 and go for that, so that we can work with you to find the right plan that fits the prescriptions that you're taking, the doctors that you're seeing, and the needs that you particularly have.
Right. And also not to pay for something you don't need. So
Right.
it's good information. Michelle, what is what we call the AEP? How long does it last? And then when does your coverage begin? Let's say I sign up with you later this week. When does coverage begin?
Come on over, Linda. I would love to help you out. Wow, this is where we at, right? AEP, another way that people refer to that is the annual election period. And that runs from October 15th all the way through December 7th. And this is the time where people, look around and see, what all the different plans that people have, all the companies, their plans that they have for 2023. So if they do select a plan between this time, it will go into effect on January 1st of 2023. And if they like the plan that they're currently on with Univera, it's just automatically going to roll over for them.
Okay. Bill, let's test your mic. Can you talk to us for a second? Let's hear if you're there. Okay, I'm sorry, it's crackling. I can't hear you. Let's jump back over to April. April, what if I choose the wrong plan? Can you further explain that? We don't want to mess up this sign up.
No, and we will work with you so that you don't choose the wrong plan. We want you to choose the right plan. But if you happen to pick a plan and it's not working for you for whatever reason, there is what we call the OEP, all these acronyms, or the open enrollment period. And this runs from January 1st through March 31st. So if you pick let's say you pick a zero premium plan with Univera, and you find that you want to move up, you want to buy up to a higher level plan, you can do that between January 1st and March 31st. You get one more opportunity to change your plan.
All right. And let me get back to Michelle for a second. Michelle, maybe we can talk about the fact that, you know, even though if you go in, let's say with your spouse, you definitely could be looking at different plans for different people. Married couples don't have to be on the same plan.
No, absolutely don't. You know, one as they sit down and, you know, with April, with Bill, with myself, you know, you kind of just find out what kind of health they're in, right? The husband and the wife might be going through different things. So the wife might pick that $0 premium plan, and the husband might want, you know, a plan that has a premium, so his copays are a little bit lesser, a little bit, yeah.
Right, a little bit less. And there's also something to be said about getting paid for being healthy. Does Medicare have any plan that commends our good health?
He does, you know, and that's our Senior Choice Extra plan, Linda. And for 2023, we're going to give back $37, you know, and the thing with that is, you know, you got to keep in mind too, is that for those healthy people, it is a way of getting back, you know, a little bit over $400 for that whole year. And if they are healthy, they get those preventative doctor visits for free. So it would be, you know, possibly a really good choice for them.
Okay, Bill, are you still with us? Can we hear you?
Can you hear me?
I can hear you, but you're cutting in and out. But let's try it. Bill, can you discuss the Inflation Reduction Act and how it's impacting Medicare?
The Inflation Reduction Act is going to put a cap to how much a person on Medicare pays for prescriptions. Many insulin products would be only $35 a month. And by 2025, the max person on Medicare is going to pay for every year is $2,000. So it's going to be a good thing for a lot of people on Medicare.
We like hearing that. That is great. April, maybe you can tell us how Part B premiums might be changing for 2023.
So also good news is that the Medicare premiums are going down for the new year. So the base premium is currently $170.10, and that is going down to $164.90. And for those that are higher income earners, those levels have been reduced as well.
Oh, that's great. And I want to let everybody know, it sounds very daunting, but once you go in and you sit down with April or Michelle or Bill, you're not going to leave without getting everything that you need and everything explained to you very, very well. So by the time you leave your session, you're going to be signed up. Everything will start to come in and work for you at the first of the year. And you should have your prescriptions taken care of, your favorite doctors and hospitals and all that kind of stuff. All of those questions can be answered for you if you work with a professional. That's why, like I say, I love going to see somebody in person rather than calling some strange 800 number. Hey, Michelle, maybe you can tell us a little bit about some of the trends we're going to see for 2023 and some of the new plans that are going to be available through Univera.
Yeah, absolutely. We've got tons of stuff going on this year. Super excited about our new PPO plan that gives back, that gives you a $500 flex card. We have a lower cost sharing and reduced premium. Let me just back up a little bit. That $500 flex card is used for dental, hearing, and vision, just so that everybody has an understanding about that $500 flex card. We have preventative dental and comprehensive dental included in all of our plans this year. So it's two different. So we have that preventative, which is the 2 cleanings, the 2 oral exams, right, in that x-ray, and then $1,000 worth of comprehensive dental that we added on to all of our plans. We've increased that over-the-counter benefits. We added the Part D Senior Savings Program to more of our plans this year. We added a transportation benefit. We lowered our routine hearing exam to free. Our gym membership is free. So again, there's some really, really exciting stuff happening at Univera this year, for sure.
That is great. Hey, Bill, what trends are you seeing?
I'm seeing with the Medicare Supplemental plans, their rates are increasing. At least they've requested an increase from the state of New York. So, as mentioned earlier, they usually get more high-need people, They provide better coverage for major things such as infusion or renal dialysis. And many companies sell Medicare Advantage as well as supplemental, but those rates are going up for next year if the state
Okay,
approves.
great. Hey, April, you counsel groups and individuals. What kind of trends are you seeing?
So a lot of what both Michelle and Bill said is, you know, the premiums for the Medicare Advantage plans look awesome across the board. Everybody's adding in dental and some great add-on benefits, which is wonderful for our clients. And as far as groups going, the rates are going up for group plans, unfortunately, as well as the Medigap plans. But the Medicare Advantage plans right now, they seem to be the way to go.
Fantastic. And I'll ask all of you this question, but April, will stay with you. What's your best advice for those shopping during this annual enrollment period?
Reach out to an expert. I honestly, all of us combined, we have many years of experience, and just knowing, you know, bringing list of medications, list of doctors, those are going to be your big things. And you want to make sure that today you have the right coverage for what you need today.
Right. And Bill, how about advice from you for shopping this annual enrollment period?
Be sure to check to make sure your prescriptions are covered by the formulary. Be sure to make sure it's a Medicare Advantage and it's well rated. If it's a standalone prescription drug plan, make sure that it's well rated as well by the federal government.
Okay, great advice. How about you, Michelle? Good advice for us during this shopping period, so to speak?
Yeah, I think April and Bill pretty much summed it up, but you know, that network is really important. You know, you always want to make sure those doctors are covered and those hospitals are covered. That's really important, as well as that 5-star. Choosing a 5-star company is very important too, because you're always allowed to get that special election, right? That one-time change that you could do during the year by picking a 5-star plan, which Univera is.
All right. Now we're going to get to the questions that were submitted ahead of time. And April, we'll start with you. Someone has written in, I turned 64 this year. What is the timeline to sign up for Medicare initially?
So when you have a 7-month window surrounding your 65th birthday. So you have the 3 months before your birthday, the month of your birthday, and the 3 months after.
Okay. Hey, Bill, how do you decide which plan to choose, Medicare Advantage or a Medigap plan?
It's important to, for one thing, to make sure you have prescription drug coverage. So again, look at the formulary for the prescriptions, look at the restrictions. For example, a lot of plans will try to keep their costs down by requiring prior authorization of a prescription, or quantity limits or step therapy. So you have to dig deep, just not look at the surface. Your Medicare Supplemental, most of them will pick up the 20% co-insurance that the Medicare Advantage do not seem to be able to provide with the limited amount they get from the government.
Okay, and again, all of these questions, all of your concerns can be answered one-on-one when you go in and sit with Michelle or Bill or April. Hey, Michelle, for dental coverage, here's another question that came in. Someone wants to know if they have to fill out forms to get reimbursed. How does all of that work?
Well, of course, we always encourage you to go to a dentist that participates with your plan, right? For some reason, if it doesn't, then you would have to, excuse me, you would have to submit the receipt with the claim form in order to be reimbursed. With the comprehensive dental, that could be used in and out of network. So yeah, I would definitely check to make sure that they participate with the plan that you currently have.
Okay. April, here's a question for you. For a snowbird, what is the best plan for people who spend winters out of state?
It depends on what kind of coverage you're looking for. So all of the Medicare Advantage plans are going to give you worldwide emergency and urgently needed care coverage. PPOs are going to give you a flexibility to see doctors in and out of network. You're going to have a higher out of pocket if you go out of network. So those are always good plans. And again, the Medicare Supplement or the Medigap plans give you that flexibility as well. So really depends on what your true needs are and what you really want.
Absolutely. Hey, Bill, we have someone who was sent this question in that they read in the refresh supplement in the Buffalo News that there is a supplemental plan to Medicare Advantage, which may assist in paying copays and other items. Maybe you can talk about this.
The only plan that could pick up the copays for the Medicare Advantage would be Medicaid. Now, Medicaid is a program for the poor. The current income cap is $954 and a resource cap of $16,800. We anticipate it's going to go up next year to maybe $1,500-1,600 for an individual. Original Medicare, you could buy a supplemental, but with the Medicare Advantage, the only thing would pick up those copays would be Medicaid. And of course, Medicare and Part B benefits with the Medicare Advantage products. The cap is up to $8,300.
All right. Let me go over back to April. April, someone has written in, and this is a biggie. Can I stay on my employer insurance? Do I have to take part in Medicare? We have people who are working past 65.
We have a lot of people working past 65. So again, it's going to depend on a couple of different things. Number one, what the ruling is, whether you take Medicare or not, whether you can not take Medicare, is number one, are you working? If you're working and your employer has more than 20 employees and you are taking the health insurance and it's credible coverage with the employer, then no, you don't have to take Medicare and you can wait until you do retire, the group goes under 20, or you no longer have credible coverage. So pretty much depends on what your situation is.
All right. So Michelle, what parts then do you have to sign up for, and why are some parts, why do some parts cover things already covered in another part? Example, Part B, and Part D.
Well, Part A and Part B, did you say D?
Yeah.
Okay, Part A, right, is your hospitalization with original Medicare. Part B is your medical, and then Part D is your prescription. I'm sorry, you cut out a little bit for me. What was the rest of that, Linda? I'm sorry.
Just wondering why what parts do you have to sign up for, and why do some parts cover things already covered in another part?
Well, you have to sign up, obviously, you got to have those two parts, right? When you're ready, as April did say, if you're on credible coverage with an employer plan, you could not take that Part B, right? And you could just stay on to that employer coverage. Part A is pretty much automatic when you turn 65, right? It's the Part B that you got to decide whether you're going to, right? You're going to sign up for it, or if you're not, for the fact that you do have credible coverage. So, it kind of, there's different circumstances for that. So again, sitting down with an expert is definitely the way that you're going to want to go. And we would, all three of us would explain all of those parts to you.
Okay, good. And because somebody is already asking, what is credible coverage?
Sure. Yeah, credible coverage is just something that Medicare considers to be credible, right? When you're leaving the employer group plan, that's considered to be a special election. So, you don't have to be in a certain period in order, right? Because we got those certain periods where you can switch over, you can change, you could do all kinds of things. So when you are on an employer group plan, that's considered to be a special election to come off to get into a different plan. And credible coverage is if somebody else wants to credible. Yeah, right, Bill. I know you got a saying for this one.
Part D, it has to be equal to or greater than your basic Medicare Part D.
Thank you.
It has to be as good as or better than
equal or greater. That was the wording I was trying to remember. Equal or greater.
Right. Equal or better. Okay.
Yeah.
April, someone has written in that they have been in a Medicare Advantage program for almost 2 years and they have no complaints. However, they have several doctor friends who are adamant that I should enroll in regular Medicare and supplement, even if it costs more. So what are the negatives to an Advantage program long-term?
Honestly, there are no negatives that
Yeah.
I know of. You have the annual enrollment period every year to change your plan.
Mhm.
So if you're healthy, you're not using services, why are you going to pay $300 a month to not use the plan when you can get a Medicare Advantage plan for no cost and be better covered? I don't know. I can't think of a negative.
Okay, so let me jump to this one. Michelle, explain which plan is better, Senior Choice Advanced Plan or a POS plan? Maybe we can explain what they are first before we figure out which one is better.
Yeah, that's one of the questions that I had in my seminar the other day. And an HMO POS plan, the POS stands for point of service, right? So that means that you're able to go to the snowbirds in Florida. Let's take that for example. They go to Florida 2-3 months out of the year, and they could see a standalone doctor while they're in Florida. So with the Medicare Advantage plan, you have a capped amount, which is $3,000, right? So you would be responsible for 30% of that standalone, that standalone doctor visit, pretty much. The POS, like April mentioned earlier, it's the flexibility, right? You could do it in and out of network. Of course, you're going to pay that higher amount, that for that out of network. I think you might have a little bit more flexibility, right? A little bit. There's not a capped amount. There's no capped amount, or that HMO POS has a capped amount. So that's pretty much how I explain it. I explain it when people did ask me that.
Okay, and I'm glad you spoke to that, because Bill, it looks like we have another question that touches on that. This question concerns PPOs versus HMOs. Here's the question. My wife and I snowbird to Florida for 2 months in the winter. We aren't looking to have doctors in Florida for routine issues, but we are looking to have coverage in the event of emergencies, hospitalizations, or urgent care. If we sign up for a local Buffalo provider's HMO plan, will we have coverage in Florida, especially wondering about a hospital stay in Florida should it occur? Or would you really recommend we go with a PPO for both of us?
An HMO is only going to cover out of network for emergency or urgent care. So that's something to keep in mind. If you might get sunburn and it's not an emergency or urgent, they're not going to pay. So that's important to know. There's restrictions under the HMO model. I can get more to depth, but I don't want to do it here, as what's customary and reasonable, what they'll pay out of the network.
Okay. All right. I'm kind of losing your audio again there, Bill. Hey, Michelle, we talk about this all the time, but it's important to bring this up again. Is income a factor at all in qualifying for Medicare?
No, it is not. And Bill had mentioned about Medicaid, right?
Right.
Medicaid is that income. They got some income guidelines to be qualified for Medicare. Only the Part B, like if you do have a higher income, your Part B premium might be a little bit higher. But for when it comes to a Medicare Advantage plan, it would not affect that.
Okay. Hey, April, let me ask you this. Can you be denied coverage for any reason for Medicare?
As in, I guess if you're talking about a pre-existing condition, no. You are eligible for Medicare at 65 or having been disabled. So you're really not denied anything.
Do you need to have your Social Security card when we sit down with you to start talking about Medicare?
Absolutely not. I don't want to know your Social Security number. No.
All right. Hey, Michelle.
Yeah.
And this kind of touches on the question before, but if you're working and you have health care through your employer and you're going to work, let's say, right through this year and you're 65, do you still have to apply for any portion of Medicare?
Well, Medicare is the Part A is automatic, right? So usually a lot of people do. This is just what I'm hearing is that people like to just touch base with Social Security, right? They like to just call them up and see, do they have to accept that Part B? Do they defer that Part B? Do they got to explain to them that they're on credible coverage, right? That lesser, or if, you know, they could stay on the employer coverage. So having a conversation with Social Security is definitely something that I do recommend as well. You know, but again, people on that group coverage, like April did mention, you know, over 20 employees, they're good. They're safe to stay on that plan.
Okay. Hey, Bill, here's one. Does Medicare pay for an in-home care of a loved one?
Yes. If it's
Okay, I see the nod. Okay, I don't hear him, but April, can you expound on that? They do pay for that.
For in-home care, as long as it's medically necessary and not considered custodial care. So if, you know, they needed to have an aide come in to do some light housekeeping or bathing, that kind of thing, that's not covered.
Okay. Hey, Michelle, we know that this open enrollment period for Medicare is October 15th through December 7th. What happens if you miss it? Are there penalties?
Say that again, Linda, you cut out. I'm sorry.
The open enrollment period is October 15th through December 7th. What happens if you miss it, and are there penalties?
Miss it, meaning October 15th through December 7th?
Yeah,
is
if
the
you
ti-
just don't, you know, if you don't sign up.
Well, this is the time where people who are on a Medicare Advantage plan review their plans.
Mhm.
So they might be in their 7th-month window, right? If they're turning 65, 3 months prior to their 65th birthday, and then 3 months after. If you miss it, you know, you could always use that special election. Like if they're already on a Medicare Advantage plan and they want to switch, they could use a special election. Is that what it's?
Yes, I'm just thinking, let's say somebody's been out of the country, you know, they turn 65, they're just not here. And all of a sudden it's past December 7th. And now they realize I got to hurry up and sign up for Medicare. Can they still come to you? And is there any penalty for missing this period?
There is another period that's between January 1st that runs to March 31st too. So, you know, during that period, you kind of like, you know, if you did switch on January 1st of 2023, that's pretty much the period where you can analyze to see if you're happy with that plan that you currently have. If not, you could definitely make a switch as well during that election period.
Great. And April, right up until now, people should be getting information about their current plan. So people should have pretty much in front of them what they're getting, what they're not getting, so that they will have this when they come on in and sit down with you.
Yeah, everyone who's already on a Medicare Advantage plan should have already received in the mail the last week of September, the first week of October, their annual notice of change. And that annual notice really gives them the information on their current plan and what is changing for the new year, so that they know on their plan what is going to be different. And then we go through and compare all the options.
Michelle, I also understand that veterans should also be checking in with you. A lot of times, yes, a lot of the things that they get will be coming through the VA, but there's always something new and different with the plans that you have. And a veteran could definitely get a lot of information and maybe even more coverage signing up.
Yeah, that's absolutely true. Actually, this year we renamed our MA only plan, and with the Veterans Plan, we're now going to call it our Freedom Plan. And those plans do not have any prescription drug coverage, because the prescriptions, right, for VA for veterans are usually covered underneath, or usually covered at the VA. But the thing about those plans, Linda, is that they have such rich benefits attached to them, right? They have that dental, right? They they have that preventative, and they have the dental, they have that over the counter. So yes, we definitely really encourage, you know, we actually, we just went to Orleans County to a nice veterans office there, and it's a nice place for the veterans to go to, like if they needed some questions answered. And we dropped off a whole bunch of our product brochures, and we're trying to really encourage them to look into these plans for the fact that it just includes a lot of those rich extra benefits.
Nice.
Yeah.
That is great. Hey, Bill, let me ask you, if somebody would like to come in and sit down and work with you on their Medicare, what should they bring with them?
Can you hear me?
Yes.
Just barely, so keep speaking loudly.
Okay. Unless the prescriptions are important.
Prescriptions?
And same as the other people mentioned, list of the doctors, list of hospitals they go to. Not all Medicare Advantage take all hospitals, or not all hospitals take all Medicare Advantage plans. So I run into a lot of people that want to go to Roswell, only to find out they're not part of the network, for example. So list of your medications, names of your doctors, and hospitals that you go to.
Okay. And is it okay if someone comes in as an advocate, if it's your sister or, you know, your elder brother, so, you know, you can hear the kinds of choices that they're making and maybe getting some information for yourself down the road?
Yes, we are a government service. I'm paid by your tax dollars. So our doors are always open.
Okay, fantastic. Hey, Michelle, how much time does it take for somebody to come in? If they're bringing their information, they're going to sit down with you and hopefully choose a Medicare plan that night. How much time should they give it?
Well, you know, you always start when someone does this one-on-one, right? You start talking about other things, right? You learn a little bit about people. People might know someone you know. So you start, right? You have just a conversation about things, you know, and it could take about an hour, you know. I mean, a lot of people already know what they want, right? Here's they did their homework, right? Because on Univera.com, UniveraHealthcare.com, there's the formulary, right? So they can look up their prescriptions already. They're healthy, so they want that $0. They want that $0 plan. So they're boom, 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 boom. You know, you kind of just still want to, you know, check off their doctors and check all that stuff. But you know, it's an hour, less than an hour. You know, for those people who want it. It's painless. It really is painless. And Linda, I just want to go back a little bit to, you know, that group coverage. I know that, you know, a lot of people are a little bit nervous, right? And I think just by the trend, I guess I should say, is what I'm seeing is that a lot of people are not qualified for Social Security yet at the age of 65, right? A lot of people have to go to like 66 and a half in order to be qualified. So again, with that group coverage, you know, the part that it's credible coverage, the part A is not required or automatic, you know, and that's something that they need to know too. If they have that group coverage with a large group, like April did say, the 20 or above, 20 or more, should I say. So, you know, again, if they have questions, please just call one of us and we'll be happy to go over it with them.
Yes, and I do want to allay anyone's fears who's watching, and April, you can speak to this. A lot of times we're seeing 1-800 numbers and they're telling you might be getting cash back and you don't know it on your current plan. And I would hate to see people go ahead and rush to that because if they're going to work with Jen or Michelle or April or Bill or anybody in this area who's qualified, you're getting everything. You don't have to worry about things like that and wondering if, oh, maybe this plan has this and I don't have this, because you could undo what you have by calling some company far and away that's really not affiliated with the government at all. And you could be making a big mistake. So we wanted to give people peace of mind to know that when they're calling one of you folks, they're getting all the information and all the benefits that they could possibly qualify for.
Right. We promise all of us, if you qualify for the $170 back in your Social Security, we're going to tell you about it.
Right.
Promise you that. You know, I used to love Joe Namath. Right now, I'm not real happy with him because people are calling and people don't understand who they're talking to is on the other side of the country, and they really don't know their providers here and how everything works here. And they're saying, yeah, you can go see that doctor, and yeah, you can go see that doctor, but it doesn't mean it's going to be covered. So we really would rather you come and see us. And
Right, because in 6 months, if you have a question, there's nobody on the other end of that 1-800 number, but Michelle will be here, April will be here, Bill will be here, and and their doors are open all year. As a matter of fact, Bill, you are the coordinator of insurance outreach and counseling with the Erie County Office of the Aging. If people would like to come in and see you, where are you located?
We are located at 95 Franklin Street, downtown Buffalo, New York.
Do they need an appointment, Bill?
It's better to have one.
Yeah.
We
And I
do
would
take
say-
walk-ins.
Okay, and I would say better probably for you too, April and Michelle, is that make an appointment. That way you can expect them and you can sit down and you can relax, have that cup of coffee and start talking about what people needs for the next year.
absolutely.
Yes, correct. Yes.
And Michelle, the thing is, the good news about having to look at this freshly every year is that our health changes. What my needs are for the next 12 months may not be what they're going to be after that. That's why, health changes, heart issues, stroke, whatever it is. This is why you look at this every year. So if something has changed in your health, you can address that and make sure you're going to have coverage for that.
Absolutely. And, we encourage that too. Like we have health fairs. There are multiple health fairs that are around going on right now. And, that's the time where all of the insurance companies are underneath one roof, right? And you collect product brochures for everybody. And yes, the very smart thing to do is to just, lay all those product brochures out and compare based off of your needs.
Hey, April, let me ask you this. What do you think is some of the biggest misinformation that people believe about Medicare?
So one thing we've already talked about, Part A being Medicare Part A being automatic. I turned 65, I automatically have Part A, and that's not the case. It is if you're collecting Social Security, but like Michelle said, most people are not collecting Social Security at age 65. So most people are not collecting Social Security. So it's not automatic. You do have to call Social Security or go online to the website and enroll in it. And I think that's the biggest one out there. And the other thing that I have seen with my clients is those that are on employer plans think that they're working for their insurance coverage and they think that's the better option. And a lot of times they're paying way more in an employer plan and getting way less coverage than they would be going with Medicare and a Medicare Advantage.
Everybody is nodding, so everybody has heard that. How about you, Bill? What are some of the biggest misnomers about Medicare that you hear constantly with people coming in?
Biggest problem is the network, where people just don't read their policies and read the restrictions of them. That's pretty prominent around here. I don't know where they get this information from, but it's just not accurate.
How about you, Michelle?
I'm sorry, Linda, you cut out again.
Okay. How about you? What are some of the biggest misnomers that you've heard, but when people come in and sit down about Medicare, things that they think is just automatic and true that is just not?
Thank you. Hospitals, everybody always thinks that all the hospitals, whether it's Catholic Health, whether it's Kaleida, Roswell, right? Roswell's a really big one. They just assume just because you live here that it's automatically, you covered. You can go anywhere you want. So, which that's not the case in some. And then, just expensive too, and complicated. You always hear Medicare is a very complicated thing. It is. It is. I'm not going to lie. For somebody who has, just a couple calls that I got today, they're like, I have absolutely no idea where to start with this, right? Of course, it's applying for that Part A and that Part B if you're ready to retire, all that stuff, right? It's the Social Security, which kind of throws people off. right? Because everybody just assumes that you got to maybe call Medicare to apply for that Part A and that Part B, where it's Social Security. So again, a couple things like that, that's just kind of what, what I've heard and what I'm hearing. And again, April, she's an expert. Bill, he's wonderful and he's an expert as well. We can't encourage that enough, just to make an appointment and come on in. Mm-hmm.
I agree. April, I also want to have you speak on this, the fact that there's a lot of people, because it can be complicated, they will just say, I'll just take whatever my husband has, or my friend says she's on this plan, I'll just do that. You're doing yourself a big disservice if that's how you're going to choose your plan.
Totally agree. And I hear that 100 times a day. It's everybody is different, and you really need to look at your needs, not what your husband needs. You look at him separately, but you look at your needs today, and you find a plan that meets your needs. You just have to do it. You don't want to be in the wrong plan.
Bill, do you find that you have to talk people out of doing that? They'll just say, well, just put me in this and I'll be fine.
I never allow that. Again, I don't sell insurance. I'm a government employee. I sell the advantages and the disadvantages of anything they choose. I hold them responsible. So I never tell anyone they're wrong.
All right. Michelle, I want to get back to the Medigap again, because we have Medicare, we have Medicaid, and as Bill said, that's for low income, the Medigap. Let's talk about what that is and how you should think about your plan to be prepared for that.
Yeah, Medigap, right, also is known as a supplement plan, like April touched on a little bit. That's where Medicare is the primary insurance, right? And then the supplement pays that 20%. So it's the secondary insurance. So when we think about original Medicare, we think about that 80-20 split. Right? That plan, we definitely do encourage for people who are going through some, major health issues, right? Chemo, dialysis, infusions, anything of those, where it would be a 20% co-insurance if they were on a Medicare Advantage plan, which, right, that can $400, $500, that stuff just adds up very quickly. So we would definitely recommend somebody to go on that plan if that's the health issues that are currently having. But another key point to that one, Linda, is that it does not have prescription drug coverage. So they do have to, they do have to go to a standalone Part D, find a standalone Part D. And a helpful tool to do that is on Medicare.gov. If you click on, find a Part D plan, it allows you to put in all your prescriptions, and it kind of gives you some recommendation. And again, I would be more than welcome to walk through that with somebody if that's, the need that they need. That's if they want that and need that, that's definitely something that I would walk through with them.
April, I think there are people who are going to be sitting back saying, well, this all sounds well and good. How much does it cost to sit down and talk to you folks?
Good question. It costs you nothing. Zero.
I love it.
I have to just chime in on that one. We were pretty busy here at the lobby of Univera, and this lady did not have an appointment, but she asked if she could speak with me. Of course you can, right? And the first thing she asked the receptionist was, how much is this going to cost me and my husband? And she whispered it a little bit, right? And our receptionist goes, oh, no, it's absolutely free. But I'm kind of curious, right? Like, how much does it cost? Like if you go someplace else. And so we were talking and she goes, oh, I think my girlfriend, here comes the story again about my girlfriend. She paid $125 to speak to someone about Medicare. And I was like, what?
No.
Right.
Wow.
April, right.
No,
shaking her head. Absolutely not.
I am a licensed broker, so I am able to look at all of the options that are out there. I am not charging anyone anything to come and talk to me. There is no reason you should pay anyone.
Absolutely.
Good advice.
Yeah,
Good advice.
absolutely free. We would be more than happy. We're here to help. And that's the line that they need to understand. We're here to help, and we encourage people to come to see us.
You represent three different facets. We have Bill with the county, and we have April with Lawley and Michelle with Univera. And the one thing I want to stress upon everybody who's watching is that this, you don't get this everywhere. This cooperation, this outreach to everybody to please come and see us. We will make sure you get on the right plane. Just give us an hour of your time. We have such knowledgeable people here in Western New York who do this all year round. And if you need to talk to Michelle Reachin in 3 months, she's going to be there at your desk. You're going to have Bill Daniels still there. You've got April. There you go. And again, you know, even throughout the year, they come and they visit businesses and they visit senior centers. So it's not a lonely type of thing, but I think of so many people in different states who are trying to make these decisions without the expert help that we have here in Western New York. So you folks do a great job. And I know that you do hear from people year in and year out. Most people don't have to change once they get a plan. You don't necessarily have to do anything, but it's the open enrollment period. And if things have changed for you, this is a good time to sit down and go through your plan again and see if there's anything that's better for you that's out there. And Michelle and April and Bill, April, you'll be happy to let somebody know if something has changed in their plan.
Absolutely.
Yeah.
Absolutely. I have clients who come back to me year after year and we sit and have a chat about what has changed. Nothing's changed. Okay, well, then stay where you are. There's no reason to change. I'll see you next year.
Right. That's right. Hey, Bill, what are you holding up here? Speak up. There you go.
And the supplemental plans. We will mail this to you. Okay. So we provide line-by-line comparison between all the plans available to individuals. Just give us a call.
So it would be great to get this, sit down, kind of get an idea what different companies are proposing, and then you pick from those choices. And that's why Bill can whittle that down for you, April can, and certainly Michelle can. They see hundreds, if not thousands, of your Western New York neighbors. And a lot of people, luckily, because we have folks like you say, you know, it wasn't as bad as I thought it was going to be. But I also feel secure in knowing that I made the right decision. And Michelle, that's what this is all about, making the right decision.
And we will guide you. We will guide you through it. You know, again, that peace of mind, right? That security that you picked the right plan. And yes, again, you know, this is what we do. We're Medicare experts. So it's free. So come and see us.
It is free. And folks, you don't have to have the same insurance plan as your spouse. A lot of people believe that's true. It has nothing to do with whatever he or she is on. You're a different person. It could be a different company. It just doesn't matter, but it's not the same thing. Also, your income has nothing to do with the plan, with getting Medicare. Okay, this is something that you're going to get when you're 65. April, we're down to the last minute or so. Any other important top of mind items that you wanted to let people know before this webinar is over?
Just reach out to somebody. Don't make the decision. I mean, a lot of people are out there to help. We want to make sure, I mean, all of us here, we're here to help you. We want you to be on the right plan. And if things change in the middle of the year, there are opportunities that, you know, if you need to upgrade your plan in the middle of the year, reach out, let us know. We'll see what we can do to make that happen.
All right. How about you, Michelle? Last thoughts?
You know what? We are here to help. Our contact information is up on that screen, right? Our phone numbers, our email addresses. You can contact us by phone, email. We are here to help.
All right. How about you, Bill?
Yeah, I put out a lot of fires when people bought the wrong plan because they were influenced by what they saw on TV. Yeah, so Michelle, Univera's got great products. April is a broker. She represents a lot of companies. I do not sell insurance. I'm paid by your tax dollars.
Right. So, talk to somebody local. That's what this is all about. Hey, we want to thank everybody, all our panelists for being with us tonight. Michelle Reachin, Bill Daniels, April Romanowski. And listen, feel free to reach out to any of our panelists. There's the information right up on the screen. A special thank you to our sponsor at Univera Healthcare, and a reminder that all attendees will have access to the recording of this webinar. So be on the lookout for the link and a thank you email from the Buffalo News and on the Univera Healthcare website in the coming days. So everybody, we thank you once again for joining us in this Guide to Medicare webinar presented by Univera Healthcare and the Buffalo News. I'm Linda Pellegrino. Remember, this is the open enrollment period, and you've got until December 7th. So by all means, get your stuff together, sit down and make an appointment with one of these fine people. And you're going to have your healthcare taken care of now for the next year. And that's what we want. But you can't do better than to speak with somebody locally and not one of these crazy 1-800 numbers. Those people do not work for the government. They're just insurance companies. So there you go, everybody. Thanks so much for joining us and have a great night. Have a great year. Stay healthy.
Thank you.